I'm Marlon Priest. I'm Executive Vice President and CMO for Bon Secours Health System. I am responsible for the market segment of seniors, and I am chairman of the board of our company that installs electronic health records for other people. As part of Bon Secours' strategic quality plan, there's been significant focus on increasing Medicare annual wellness visits. Today, Bon Secours is a nationwide leader in the practice. As of August 31st, 2017, annual wellness visits system-wide increased to nearly 67% from 24% in September of 2014. This is compared to less than 20% of Medicare Part B beneficiaries completing annual wellness visits nationwide. So why has Bon Secours been so dedicated to this initiative? So many activities that are successful in America have someone with a personal passion. During my time as a Robert Wood Johnson Health Policy Fellow, I spent a fair amount of my time there trying to get Medicare legislation to include an annual physical and an annual wellness exam. I don't think we used the term annual wellness exam because I believed that Medicare at that point was a sick care program, and doctors were forced to falsely give a reason for a test. You couldn't do an EKG because you wanted to just see if somebody was okay. So we spent time trying to get that passed, and it didn't happen then, but ultimately it's a part of Medicare's benefits for 65-year-olds. And the value of that is we wanted a place where in a non-crisis moment, a patient and their provider could have a conversation about the current state of their health, blood pressure, weight, exercise, depression, food habits, fallen recently, all the things that would allow the two of them to create a care plan for the patient. And the patient then manages that care plan with their practitioner and their family over the course of the next year. We thought that was so important for people. Sacred space, sacred time, paid for. It's 45 minutes to 50 minutes of time. So our commitment as an organization here was that we are very committed to the individuals who live in our communities, and we're very committed to seniors, who are a large part of our community populations. And we said we want to be very good at creating that sacred time, using that benefit to help people create what they wanted to do for themselves over the next few years. You want to go to your daughter's wedding, you want to go play golf, you just want to feel better. Here's a way to start that process. What are the benefits of having an annual wellness visit? Well, you and your doctor have a private space and time when you have no health crisis to talk about the things that you do well, the things you want to accomplish in your next year, and what are the things that need to be done. So you can discuss your weight, you can discuss your diet, you can discuss whether you're depressed, you can discuss your exercise activity, and what are your goals. So what we've asked our physicians to do is to be sure that in the record, your personal goals in your own language are recorded in your record. So that annual wellness visit gives you a place to do that. And you can build then a care plan for yourself over the next year. So you can have goals over the course of the year, and at the end of the year, you can say how you're done, repeat the exam, and start the process again. So the benefit is it's time without illness. It's time with your practitioner to address those things for which you may not be willing or have the time in another visit to talk with your physician about. So what type of preventive care assessments are provided for patients who have that visit? Well, you can actually, Medicare has a whole range of preventive services, mammograms for women, lipid profiles, electrocardiograms, prostate exams. There's a whole panel. And for any Medicare patient, or maybe more importantly for the children of a Medicare recipient, go to the Medicare website, look at the preventive services. You can even download a list of those services so that you can be sure that age appropriate and timing appropriate, you're getting the preventive services that you need that are covered by Medicare. Depression screening began in September of 2016 as part of the Medicare annual wellness visits for screening patients 65 and older. So what occurred to make the system decide to add depression screening as a board-approved goal? Well, we started with annual wellness visits, and we realized that our next step, and we'd planned this, was to begin to address behavioral health issues in our communities. In the communities where we've performed the required community health services needs assessment, one of the things that keeps coming out near the top is the availability of behavioral health services. We wanted to build a culture that would make us comfortable with behavioral health. So instead of taking on some of the more psychotic or challenging health problems, we needed to get our organization comfortable with behavioral health. So we felt depression was a place to start. Depression screening, prevalent in every age group, debilitating. It impacts every illness and outcomes of every chronic illness: diabetes, hypertension, obesity, cardiovascular fitness. And so we wanted to get individuals started along those lines. So we started with depression screening. Easy to do, gives a wealth of information. Everyone needs it. We had a way to get it into the electronic health record to be able to begin to drive our work around behavioral health. What is involved with the depression screening, and why are they important? Well, depression impacts 15-year-olds, it impacts 12-year-olds, it impacts 50-year-olds, 60-year-olds, male, females, and every day we know of some young person or middle-aged person whose depression was missed and they committed suicide. It is becoming such a prevalent diagnosis in our society. We felt we needed to understand how to interact with individuals that had behavioral health challenges, how to be comfortable talking about them, and how to get them comfortable talking about them so that we could provide them the services to help them deal with that. In 2017, primary and specialty care providers began expanding depression screening to patients 12 and older. Why was the decision made to expand the screening to younger patients? Well, we'd learned how to screen. We'd learned how to help our providers and our patients understand what you could find in screening and how you could address those preventive health services and needs. So then we said, the next place for us to serve our community is to build our behavioral health capabilities and to fulfill this big need that keeps coming up in our community health assessments. So since we could build the record, since we could teach it, since we'd had some success, we said, well, let's now begin to screen for depression. Depression screening would require us to ask everyone a series of questions and then begin to get a conversation between the provider and the patient, which may even lead to a conversation even with their family members around, are you depressed? Are you sad? Is life worth living right now? And we wanted to have something that would build energy and excitement in Bon Secours, because everybody in Bon Secours knows someone that is depressed, or someone's depression that has been missed and they've committed suicide, or someone's depression's been missed and they've committed suicide and a homicide. So we wanted to have a way for the company to get comfortable with talking about and dealing with behavioral health challenges, which have largely been hidden in our society because people don't feel normal and we don't necessarily feel comfortable addressing in the past the fact that they don't feel normal. Between January and August of 2016, Bon Secours screened 19.92% of patients over the age of 12 for depression. The system set a goal to increase screening to 29.92% between January and August of 2017, and it surpassed this goal with 52%. Patients receiving depression screening. Why? Well, I think once the momentum got started, as it did with annual wellness visits, once we convinced our practitioners to be comfortable asking the questions, finding the location in the record for the reminder, and working with our patients to be comfortable to answer those questions, we then saw the snowball roll. We said, okay, let's get started. Let's build easy tools. Let's encourage it. And what'll happen then is it'll grow. So, at 50% plus, I think we're leaders in our marketplaces. But at the same time, that means there are a number of patients who still aren't being screened. And so we still have some work to do. The behavioral health group that Jeff Oak serves as executive sponsor for has come together face to face at least twice. And in those we decided to work with depression. The most recent meeting they were working not just around finding depression, but protocols to make it easier to treat. One of the challenges you have is there's not a large enough psychiatric physician community, so we needed to learn how to build protocols so the primary care practitioners could treat most of those patients for their depression without having to refer them to a psychiatrist. And so they were developing in their last meeting the protocols that would be rolled out to expand the availability of services for the treatment of behavioral health, and particularly the services for those patients who have depression. By August of 2018, Bon Secours had a goal to screen more than 62% of patients over the age of 12 for depression. So what additional steps are being taken in place to reach that goal? Well, the steps are, it resets every year. The beauty of it is every single year we have to screen every one of our patients. So when we got to January this year, our great success last year sort of reset. So when you're seeing the numbers today that are not where we were last year, we'll get there. The excitement of the individuals involved in the group, the excitement of our practitioners now that we've made it easy to do, and we talk about depression in a way in which we believe and feel comfortable we can do something about it. We have the ability to keep young people and middle-aged and seniors from hurting themselves and hurting someone else. That kind of excitement will exceed that number this year, and will exceed the number of people that get appropriate treatment. By spring 2018, the system expects to launch a pilot collaborative care model in Greenville that embeds behavioral health care managers like social workers in the primary care setting. Let me tell you a little bit more about how that model works and what we expect to happen with it. We were very excited when we got introduced to a psychiatrist who had a particular interest in this area. He was recruited to Greenville and works with the Bon Secours Medical Group in Greenville. He's developing the collaborative care models. These are models where the model of care for the patient who has depression doesn't require them always to leave that doctor's office and then go to a psychiatrist's office. We build protocols, we build behavioral health and support models in the practice. And so you build those models, you deploy them in the practice, because the majority of patients with mild to moderate depression do not require being seen by psychiatrists, which are few and far apart and not enough to be able to treat all the patients. And our physicians were saying early on, why do I want to make this diagnosis? I can't get anybody to see them and treat them. I can't get them an appointment, and I don't necessarily know what to do. So we wanted to build, so Dr. Falcao helped us build the protocols. It's helping us spread the protocols across all the Bon Secours Medical Group to be able to treat the majority of those patients in their current setting without having to have them change. An interesting note is that the clinical literature demonstrates that if we find your depression and if we treat your depression appropriately early, your number of visits to the doctor and your use of healthcare resources go down. So for those patients who we're caring for that have large copayments and deductibles or have to take time off from work to be able to go to the doctor, if we can manage those individuals earlier, they feel better, they have more time for their families, they feel better at work, and their total cost of care goes down. Well, I think we as a company have had several conversations with our employees about post-traumatic stress, around depression. I think first of all is to talk about those experiences you're comfortable with around behavioral health challenges. I think secondly is to show that we are trying as an organization to identify your healthcare needs, and those needs of behavioral health needs are just as real as blood pressure treatment, as obesity treatment, as is cardiovascular treatment. It is another series of of diagnoses that have therapeutic options for us to make people feel better. So I think begin to think about behavioral health illnesses in the context of they're one of the diagnoses that we face every day in our society, some in our personal lives and some in our families' lives, and that we have options for treating those individuals and supporting them. Because if we don't make it a comfortable conversation encouraging people to get treatment. I can tell you a little story about when in our medical school, young medical students were so afraid to be identified as having depression or anxiety that they wouldn't go to the student health clinic. So many schools actually built a behavioral health clinic inside the student center, but you had to walk through multiple halls and doors, and there was no sign on the door. You just had to know where it was, like the secret door, to get people to go in and therapy. And that was really interesting because you would think in a healthcare profession, individuals would be quite receptive to being seen. They wouldn't, because they felt there would be a stigma. It would avoid them getting the residence they want. So we've seen that. We've also seen companies who give patients access to a psychiatrist directly for their depression have found more individuals get their depression treated and feel better. So since there aren't enough psychiatrists, our strategy was, let's find the person you have the best relationship with in the healthcare delivery system, your primary care physician. You can have that conversation, you can get treated, and you can encourage your friends that if they think they have depression, ask their doctor to go through the screening. Ask your mother's doctor to go through the screening, or your father's doctor. The more we can make it comfortable for someone that you are close to have that conversation, I think will reduce the stigma associated with behavioral health illnesses. One other point I'd like to share is that one way we created interest around the country and in Bon Secours was to remind everyone that behavioral health is its own service line. There are a lot of behavioral health illnesses we have to treat, but at the same time, it impacts every other service line. Many of you will know mothers who've had children and developed postpartum depression. Many of you have known individuals who lost their job or retired and developed depression. So the way depression is woven into our society, especially in the face of the fact that everybody we know on television has a perfect image. They're all 25, they're all the same age, or they're all macho, or they're all driving sports cars. We don't talk except in shows, but for commercials, we don't really talk or show people who are have challenging health issues as much as we should. So because everybody feels normal, is without pain, without depression, normal size, normal height, normal complexion, no acne, then we've created this standard that if people don't meet that standard, they're not sure what to do with it. And so we're trying to give individuals to understand that, again, behavioral health is its own service line with its own illnesses that we have to recognize, but it also impacts so much everybody's daily life and every other illness they may have.